For many decades, America has been having a great debate about health care. Who should provide it, who should get it, and who should pay for it? The major parties put forth conflicting proposals, and the debate goes on and on. But for the last 40 years, a remarkable organization based in Bakersfield, California, has been providing quality health care to those who need it the most, but can afford it the least. Their 70 locations spread over 3 counties are known collectively as Clinica Sierra Vista. And I want you to meet the man who's made it all happen. Steve Schilling, you are the Chief Executive Officer of Clinica Sierra Vista. When you came to this organization 39 years ago, what did you find?
Well, I found a very small program of less than a dozen people working out of a storefront sort of makeshift clinic in Weed Patch, California, providing care to seasonal and migrant farm workers. It was in a bit of disarray. It had gotten into some trouble behavior-wise in terms of how they spent the money, and the federal government had placed it into a receivership. And I came down here in response to the circumstance of that situation and subsequently accepted a position, and the rest is history.
Where did you come from and why take on that challenge? What excited you about it?
Well, I came from Northern California down to here, but prior to that I had grown up in that part of the state and had gone to college and graduate school, and I had then subsequently served in the Peace Corps for a couple of years. I was drawn to the work of working with the underserved. I had done that in my overseas experience. It fit with my personal interests, my own code of what I wanted to do with my life. I had no idea what I was getting into, and I knew nothing about healthcare. But it seemed to be an attraction. I could maybe have a chance to turn around a important human service nonprofit organization, and I took on that challenge.
What was the original vision for Clinica Sierra Vista, and has that vision evolved and expanded over the years?
Well, the original vision was as I found it, to provide care to migrant and seasonal farm workers. That was a program that had begun across the nation in maybe 100 locations just a few years earlier. But then over time, that original mission expanded and grew into something much grander, which was to provide care not just to the special population of farm workers, but to all persons in America who are underinsured or underserved, or special populations like homeless or HIV, patients continuing, of course, with our focus as well on farm workers and persons who are marginalized, people who have less opportunity to access primary and preventive healthcare services than the general population.
Describe the range of services that you offer to these people.
Well, today, and since that point, the growth trajectory has been pretty immense. And so today we provide primary medical, dental and oral health services, behavioral health services, a whole host of prevention and enabling services, WIC nutrition programs, substance abuse programs, special programs aimed at HIV patients. We have mobile units. We have programs working with families through family resource centers, teen pregnant patients, educational programs in the schools and the junior high schools. So we have a lot of things that we do here at Clinica today that were not necessarily part of our original beginning purpose back in those early days in the 1970s.
How do you attract the high quality of professionals, doctors, nurses, caregivers that you bring to this organization?
Well, I think we attract them because of the purpose and the mission, and we keep them here for that. It is a struggle, I will tell you. We live and serve in probably the most underserved medical area and oral health area anywhere in the West. It is a challenge to bring professionals to this community. We've now begun a residency program, and we're starting to train our own that we hope will stay with us, and we have residency programs in dental and nurse practitioning and other programs. We keep them here, and we, I think, attract them here because they want to join in this work. They believe that this is the cause of why they became healthcare professionals. And we retain them for that same purpose. But it is not an easy task. And as time goes by, and as the influences of outside organizations and other healthcare providers grows, we have to really move quickly to stay up and keep them here with us, serving this population.
What have you learned about what is unique and truly special about your target population that you serve, the people you take care of?
Well, we've learned they're really appreciative of us being here. We have very content patients, mostly, not all the time. But by and large, our population really appreciates that we and our organization and its people have made the commitment to serve them. And that's, I think, been very heartening for me to see and to experience the acceptance of our program. Very often, we have people from very different cultures. We speak 17 different languages here at Clinica. We have people from all over the globe here in the Central Valley serving with us, a population predominantly Latino, but many other minority populations as well. And so this is a little United Nations, and we really do get along pretty well with each other. And I think the population is so thankful, so appreciative, so welcoming, that's been one of the real joys of being here.
You started out in such a small location, in such a humble place. Describe the reach of your organization now. What areas do you serve? How many locations do you have?
Well, we have about 30 primary medical care locations. We have 8 going to 10 dental facilities. We have 30 WIC sites. We have 10 behavioral health locations. And then we have a whole host of other programs that we operate in other locations, a total of about 70 plus addresses in Fresno, Kern, and Inyo counties. And now, today, fortunately, we've become the 4th largest community health center in the nation.
Have you become a model for others to follow?
Well, I think the whole community health center world and movement has become a bit of a model. Bipartisan support going back many decades on all sides of the political aisle have recognized that community health centers have established themselves where maybe other people haven't wanted to be, and where the need for primary and preventive health care services is so immense, and that we've got to start there, or none of the reform discussions that we've ever had are ever going to work unless we take care of people at the very early stages of disease and promote wellness. So the model of health centers, and certainly the model of Clinica, is really a model that is being replicated in other countries. It's a model that has enjoyed very significant bipartisan support, even up to and including the present time. We are recognized by all of the various parties that this is really something the nation has to have. It's got to have this kind of a program, and partially funded with federal dollars.
And what is your highest vision for the future of this organization?
Well, boy, that's hard. I think we haven't even begun to understand some of the models of care delivery that are going to happen in the next decade or two as we embark as a nation into the early stages of health reform, as we begin to think about population health and where that's going to go, as we're going to confront the challenges of how we're going to pay for all of this going forward in the next years. I think the role of our kind of program is pretty solid. I think we have to be flexible. I think we have to be inventive. I think we have to be creative. I hope there's a place for us for the next 40 years here.
Steve, I know that President John F. Kennedy was a great inspiration to you. I think that's part of the inspiration that led you to the Peace Corps. You recently delivered an outstanding address to the graduating class, the 2016 graduating class of California State University here in Bakersfield. I've listened to that address and found it outstanding. And what was the main message that you really wanted to communicate to those graduates?
To matter, to be engaged. Engagement is a big personal issue for me, to give back to your community, as President Kennedy certainly emulated in a lot of his early work, and certainly the Peace Corps was an example of that. I want graduates today, young people today, to be focused on something greater than just themselves, that they have an obligation to the communities they come from, to the families that have supported them during their lives' journey, to the organizations and places they inhabit. They have a duty to give back. They have a duty to be involved. They have a responsibility to help those who are less fortunate than they are. And that's what was the message I was trying to share with them, that their responsibilities are going to continue much beyond the awarding of that day's degree.
Steve, I think it can be fairly said that you as a leader and your organization as a servant to this population can truly be described as California's finest.
Thank you very much.